Hi, this is going to be a quick overview lesson for those of you, especially who are beginning your journey, um, to remind you of things that you need to do sooner rather than later. There are other videos on this YouTube channel that you can already access that will go into more depth on each of these slides, and then there will be additional ones added at a later time that will also enhance what you're seeing here. This is going to be a very brief walkthrough. So let's talk about what you should do sooner rather than later. We're going to be talking about acceptance, legal documents, learning what to avoid, learning what to take, learning how to take those medications. What about where to live? Decisions about that. Building your team, home modifications that you need to make sooner rather than later, in addition to the supplies and equipment you may need to gather. First of all, let's talk about acceptance. When you get this diagnosis, it's going to throw you for a loop. You really need to move as soon as you can as the primary caregiver from a position of not being able to handle this and process this to getting to a point of acceptance so that you can move forward. This is a challenge, but you can do it, and it's essential for you to be able to get a handle on things, to find your feet again. What about legal documents that you're going to need to have? This is something absolutely sooner rather than later that you need to make sure you have on hand, consulting knowledgeable people to help you. More than likely, that is going to be an attorney in your community, but it could be an aging care manager who can point you to the attorneys who are very good at doing this, and also some other resources that may not be at a cost to you. And people in your family who already have some knowledge about these tools. The first three are ones that you, with the asterisk, are ones that you should have on file in your courthouse, wherever county courthouse, wherever you live here in the United States. They are power of attorney, which gives you control over financial matters, healthcare or medical power of attorney, which gives you, makes you the key voice in decision making for anything involving the health care of your loved one with dementia. And the will, which involves getting you, making sure that the estate is managed properly after the person has passed away. The powers of attorney, both health care and usually it's called a durable power of attorney, are going to end at the point of death. The person assigned as agent for those will no longer have that position unless they are also listed as the person who is to execute, be the executor of the will, the executor of that will. So it's important to understand that. A living will, a DNR or do not resuscitate document, a MOST document or POTS document, which are basically medical orders, physician's orders for special treatment, things that are needed for this dementia patient, especially when they are in an assisted living setting. These are things that you'll want to learn about. Transfer or adding names to account. This is something that you can talk with your banker or credit union officers. You may be able to, at no cost to you at all, very simply be able to get a little more control over finances in particular, just by doing some of those things, depending on how the rules work in your state. Now, what should you avoid? First of all, situational triggers, personal triggers. Triggers are things which cause bad behavior to happen. They're going to vary from person to person, but there is some general knowledge about typical things that can cause problems. There's a lot to talk about there, and I do have information on the caregiver channel. It's Pat Snyder's channel, which will be at the end of this presentation so that you can find that, and we'll be adding more as time goes by. So avoiding those triggers if you possibly can, very, very important. And if a dementia diagnosis is now in the story, avoiding the hospital if you can, avoiding surgeries and procedures that involve anesthesia or being in that kind of setting, if you possibly can, is wise at this point. You can learn more about that by looking at the more in-depth videos. But Please keep these things in mind, that avoiding triggers, avoiding hospitalizations are going to be wise things to do in many, many cases. Also, in terms of the medications themselves, these categories are something you are going to need to become familiar with if your loved one has dementia. The category called anticholinergic. There are many, many of these out there on the market for many conditions, and they interfere with neurotransmission. Very important that you learn about that. Benzodiazepines also are a category of drugs you need to be aware of. Antipsychotics, especially of the older type, you need to manage very, very carefully. Avoid if you can. But if you need them, be very careful about the choice, be very vigilant. Over-the-counter sleep medications are something you should avoid, because here again, they may impair the functioning of the brain in the normal way. Especially diphenhydramine, which is often known as Benadryl, is in many of these over-the-counter medications. It is something you should avoid if you possibly can. It can create a lot of chaos for older people, and research is beginning to also say maybe even for middle-aged people, and especially for dementia patients. Some of the worst things you can possibly take that you absolutely must avoid are Haldol, Versed, and some of the inhaled anesthesias. Haldol is something that's given for agitation, often in the emergency room or hospital when a person becomes very aggressive or agitated, and it's given as a shot. A lot of times giving things in shot form is a signal that you probably might not need to be doing that. But Haldol in particular can wreak havoc on the dementia patient. And for a Lewy body dementia patient, it can be actually deadly. So you do need to avoid that if you can. Versed is often given as a short-term anesthesia type, a kind of anesthesia, but it involves helping the person forget what happened. You do not want that part of the brain that deals with forgetting to be messed with in any way. So a good alternative for Versed for short-term procedures is propofol. Once again, I have an entire presentation on medications to avoid, which will flesh this out a lot more for you. But what about what to take? What is recommended for dementia patients, not necessarily frontotemporal, but for many of the other dementias, are the cholinesterase inhibitors, Exelon, Aricept, and Razidine. Namenda can be added to the cholinesterase inhibitors medications because it has a different pharmacological mechanism of action. And it is addressing another neurotransmitter called glutamate. The cholinesterase inhibitors addresses the neurotransmitter acetylcholine. These are FDA approved for Alzheimer's, so for the other dementias will be given off-label, but actually for Lewy body dementia patients, the cholinesterase inhibitors and sometimes the Namenda work even more effectively than for the Alzheimer's patients. So it's very important to know if Lewy body dementia is in the story. The newer antidepressants might help with some patients, in addition to the cholinesterase inhibitors, if depression is a major issue for your loved one. But you should be keying in on the more modern versions of the atypical antidepressants, if that is something that your loved one might need, in addition to the cholinesterase inhibitors. How to take the medicines, very, very important. Only one change at a time. I also talk about this in my other videos about medication. One change at a time. So there's only one variable to consider if things go wrong or if things go right. So try not to have two medicines taken away, two medicines given, one taken away and one given at the same time. When the medication is given for dementia patients, start with as low dosage as possible. Sometimes with highly sensitive patients, you may even need to go to half the lowest dosage if that is possible. Once you start with the lowest dosage, you wait, you go slowly. You don't, if you see some benefit, immediately uptick or up titrate up this medication. You go slow, you give it several days, a week, 2 weeks. Give the brain an opportunity to respond or possibly react to these very, very powerful medications. So low and slow is a mantra you need to embrace. Reduce the number of medications when possible. Polypharmacy is very common in older patients. Sometimes if you can just take away the wrong med or just reduce medications so that they're not working against each other or having kind of a double bad side effect and clashing with one another, can make a huge difference. So reduce the number of meds when possible. Focus on the dementia impact first before adding any medication. Focus on dementia first. This diagnosis needs to be driving the train going forward. What's going to be the impact on this now impaired brain? Dementia is not just a memory disorder. It is a brain failure disorder. These are powerful medicines. So anything that you are putting into that person's body can have a negative reaction that's unintended. And so remember to always look up the name of the medication, go back and put in things like anticholinergic after the name of that medication. Google it and see what you get. Is it in that category? Is it a benzodiazepine? What are the side effects? Is it recommended? Could it cause more confusion? This is one of the side effects you want to try to avoid. So paying close attention to what is this new medication possibly going to bring into this story? And is it worth it? Is the price tag for this medication and its possible benefit worth the cost that may occur for this dementia patient? Very, very important to embrace these ideas on this slide. Okay, another thing you're going to have to decide early on, once you know that dementia is in your story, is where are you going to live? Are you going to stay in place, modify your current home? Are you going to move nearer to family for support, possibly move in with family or have some of them move in with you to give extra support? Are you going to relocate to a single home and a single story home so that you're all on one level? If stairs and having all the bedroom upstairs is going to be a problem. Moving to a continuing care retirement community, if you can afford to do so, is one of the ways to give you a place to stay together. And then as needs become greater, you will have sort of a tiered level of a place for your loved one to move into as the need is greater, while you could continue to stay in independent living. So that's something to consider if you have the resources to do it. Moving the person living with dementia to an assisted living community is something you're going to have to think about. Your family's going to need to discuss. That may or may not need to happen at some point, depending on how things unfold in your story. And one of the things I always want to tell you and remind people of is if you've seen one dementia patient, you've seen one dementia patient. There are many commonalities, but each individual is different. Each family is different. There are different strengths and weaknesses and needs there. So where to live is going to be one of those topics that you're going to need to decide. Building your team early on, sooner rather than later, is so very important. Physicians, who that physician is vital. The physician needs to tell you what kind of dementia you're dealing with. It could be hugely important. If it's Lewy body dementia, it's massively important because you manage it quite differently from Alzheimer's and many of the other dementias. So you need a physician who's either already very knowledgeable in the form of dementia that your loved one has, or a physician who's humble enough and wise enough to want to learn, to listen carefully to you, uphold you, support you as the caregiver. Understand that you are the coach of this team. The physician's the vital member of it, but you are the coach. You're the person who hires and fires everyone who comes into this story. So I hope you will embrace that, take hold of that control. It does give you some control, and choose a physician who is going to be wise and kind and either already knowledgeable or willing to become knowledgeable in how to really help you and your loved one best in this journey. The pharmacist is also vital. The pharmacist is going to view the medications from a different angle. They're available to you free of charge whenever you walk into the pharmacy or call them up. They are familiar with the best doctors in the community and the best methods that those doctors use when it comes to medication. They will be able to quickly check on side effects for you so that you don't have to always do that yourself. They will also know good substitutes that you might have conversation with the doctor about making if one medicine might not be quite as good because there's a potential bad side effect. So the pharmacist, hugely important. Counselor, I cannot say strongly enough, please get a counselor to help you in this journey. If your loved one is still in early stage, let them go with you or let them separately have counseling. It will help you both tremendously in navigating this disease and communicating with one another. When John could no longer go, my husband John had Lewy body dementia. When he could no longer go with me, I continued to go to our very wise counselor. And he helped me navigate. He helped me when I would get off balance, when I would forget about my focus and where it needed to stay and my approaches. And then after John passed away, he helped me with the grieving process. So a counselor is hugely, hugely important member of your team. And I hope you will embrace that and bring that person on board. And wait until you get one that you really can connect with. Don't just take the first one if it's not a good match. Different therapists may come into the story later on as you're walking in your journey, a physical therapist, speech therapist, occupational therapist. I have the wrong letter here on this slide. It should say LSVT instead of RSVT. LSVT stands for Lee Silverman Voice Therapy, and it is a particular kind if the voice has become soft, and I know for Lewy body dementia patients this is very common. If the voice has become very soft, it helps with the loudness, the volume of the voice, and being able to focus, and also giving initiative to speak and confidence in speaking. There is a program called Big and Loud, which combines the physical therapy with speech therapy, and it helps with both movement and with the volume of the voice. And I do recommend that if you look up Big and Loud therapy. You might not have thought about adding a handyman to your team. Very, very important. Please consider doing that, especially if you are a woman living alone with the person who has dementia. You don't want to be doing things that a handyman can do for you. That's a place where you do need to write some checks, invest some money, because it can keep you out of the hospital. It can keep you safer, calmer, feel more in control of your household. That handyman can be vital and very important to you. Paid caregivers may eventually come in either into your home, or if you have to go to an assisted living facility with your loved one or send them there. Paid caregivers, selecting them, training them, very, very important that those are the right people who do know how. They know what to avoid and they know what to do. Notice at the bottom of the screen, I have family, friends, and neighbors. They are your fundamental foundational group. They are your gold mine. Your family members who are willing to move toward you, your friends who move toward you, they are just wonderful assets. Do not take them for granted. Spend time with them. Give yourself respite with them. Your neighbors who will just pitch in and do things, even if they're small things, that can make such a difference. One of my neighbors would take out my trash can for me. I had a bit of a steep driveway, and he helped. And it just made me feel cared for there in my neighborhood that he would do that for me every week. Little things like that, learning to ask people for help. The people on your team are there to help you. Dementia caregiving is not a solo sport. It is a team sport. You are the coach of that team. So sooner rather than later, build your team and then use your team. Okay, if you decide to stay at home, you will need to modify some things. Access ramps, doorways, bathroom, stairs. If you have stairs in your home, figuring out whether to block them or whether to put in some, like a chair riding up, one of the chairs that will go up the stairway. Decide how to navigate that. grab bars everywhere you can think to put them. An occupational a therapist walking through your home can make a huge difference helping you with that. Having in some sort of way to lock your doors and have alarms either at the door or at bedside or in the bed, something where in the middle of the night, you know if your loved one is trying to get out of the house. Very, very important for you to have those helps. Here's an example of an access ramp that I did. I just want to very briefly show you. Here again, there will be other more in-depth explanations of these things, but you can see the before, my 1954 side entrance in my house. 1954 is when that house was built. And you can see that was not usable and not smart. With those two uneven steps and that cracked and leaning sidewalk, and it got modified to this, which was very user-friendly, easy to use with a wheelchair. We never did need to put up railings along there. The soil was moved up to that sidewalk, so there wasn't a step down there. And we just were able to stay in our home and be very comfortable, both John and myself. I was able to carry groceries in and out so much easier with this. And then the bathroom in that 1954 house, you can see here, except with the pedal sink, which I had added and updated a little before this picture was made. But I had to convert it. In the back, I will go into much more depth in another video. But basically what you need to know is at the back that you can see where the toilet is, that whole section of the bathroom is a wet zone. The floor tilts down to a drain, so that entire area could be washed down with hot water, Lysol, with me standing, not having to bend, no twisting. Very, very easy to clean. And the other thing you need to know, without me going into too much, is that there was a bidet seat on that toilet. That is not a regular toilet seat. A bidet seat washes your bottom, and it made a huge difference in being able to help John with his toileting. And he wasn't hurt, I wasn't hurt, and it actually also helped him with the constipation issue because there was a soft warm spray there on his bottom, and it helped him to relax. So these kinds of things you can do to make things better, and do them early. Do them before, well before you need it, and try to do it so that it's attractive like this is, because when it was time to sell my house, that bathroom was the #1 feature that people were drawn to. So it helped me sell the house actually, much more so than the original one would have. Okay, the equipment that you might need to have: work towels. Pick a color system, either use colored towels versus white ones, the colored ones being for your work, or use go buy a bunch of inexpensive all one color and put them everywhere: bathroom, bedroom, wherever, the den where the person sits. You can convert that towel by cutting a little X mark in it toward one end and put that open space over the person's head, and you have an automatic cover for them when they are having some problems with their eating in the later stages. So work towels are just inexpensive, and you need to get them early so that when there is a mess to clean up, you're not fretting. You have the basic tool there to clean it up. You may need to add a wheelchair, shower chair, incontinence items, inside video cams, which are like the baby cams. A lot of them now you can hook to your phone so that even when you're not at the house, you can see what's going on. GPS tracking devices. A lift chair may or may not be a good idea because the person may easily lose their balance, or they get out of practice using the muscles in their legs and arms to get themselves up safely. Or you may be a better assist person than the lift chair. Getting a hospital bed, very important before you need it, and a Hoyer style lift, which is the kind that will allow you, without hurting yourself, to lift the person off the floor if you need to and move them from place to place. My husband was about 200 pounds, 6 feet tall. I'm about a little over 5 feet tall and with back issues. And because I had that lift in my house and that hospital bed, I was able to do what I needed to do without hurting my back. Here is the YouTube channel I do want you to be aware of. You can pause this video and see what that address is. My channel name is Pat Snyder. There is more than one Pat Snyder, so look for the one that has dementia or caregiver in the little description on Google when you Google it, or if you're going into YouTube. There are going to be several videos already there as I'm doing this one, and more are going to be added on all of these topics. So I hope you will take advantage of that and get some more in-depth education quickly. Share it with other family members so you are not doing this by yourself. You are able to share this information with them. God bless you for what you're doing. Thank you. It's heroic work. And I hope you do many of these things sooner rather than later so that your stress is reduced.